Hi, I'm Dr. Aaron Filler, and I'd like to welcome you to Spine and Nerve Health. First, let me tell you a little bit about myself. I've been a co-director of the Comprehensive Spine Center at the UCLA Medical Center, and I'm a director of the Institute for Spinal Disorders at Cedars-Sinai Medical Center in Los Angeles. I have a PhD from Harvard University based on my research in spinal anatomy and the comparative anatomy of the spine, and I maintain an active neurosurgical practice where I apply the most advanced technology, some of it that I've invented myself, together with the best surgical craftsmanship for the treatment of spine and nerve problems. Every person who suffers from back pain has probably wondered if surgery is the right solution for them. It's an important question and an important decision because every back surgery may be a major surgery. In order to make the right choices, you need to understand all of your options. There are many possible causes for back pain. These include tears and injuries in the ligaments and muscles, problems with the shock-absorbing discs between the vertebrae, pain that comes from the facets or small joints in the back of the spine, and it can also come from the small nerves that surround the spine to the discs, the joints, and the tissues around them. Not all back pain comes from nerve problems. It's common to see patients who suffer from back pain that is related to an ulcer, a kidney stone, a problem with a major artery, or even an undiagnosed tumor. So it's important to see your doctor if you have persistent back pain. It might be something you never expect. Fortunately, the vast majority of back and neck pain problems will actually resolve on their own over time without surgery or any other intervention. In many cases, various types of therapy can help accelerate the improvement or help reduce the chance of recurrence. This device is helping to apply a stretching force to the neck. This can help a herniated disc recede into a normal position. For some, the problem doesn't go away, unfortunately. It lingers and often worsens. Thankfully, for these patients, there are new advancements in medical imaging which can help surgeons to accurately diagnose and treat back pain. In the past, nerves were invisible on medical scans. Doctors could not pinpoint the location of nerve pain. But today, thanks to the latest in imaging technology, some of which I might add I personally was involved in inventing, qualified physicians can determine the exact spot where pain is occurring. What was once invisible is now right on the screen for the neurosurgeon or orthopedic surgeon to see, diagnose, and treat. Here, you can see the location of one patient's persistent back pain. In this image, the pain is identified as being a nerve in the L5-S1 region of the body. With this information, a qualified physician can then create an appropriate course of action to resolve the ongoing pain. When surgery is required, based on your diagnosis, there are many different types of procedures your doctor might choose to recommend. Some are highly invasive. Essentially, any surgery requires the surgeon to go inside the body. However, for the same operation, one surgeon might carry out a very large exposure requiring a long recovery, and another surgeon might accomplish the same effect through a small, minimal access procedure. In my practice, as is the practice for a number of leading neurosurgeons, it's common to turn to less invasive procedures. One example is an MR-guided injection, which can alleviate back pain, neck pain, or leg pain caused by a nerve problem. These procedures require only a small needle injection, and recovery is the same day. And in fact, in most cases, MR-guided injections don't even require full anesthesia. The patient is awake during the procedure. The result of a minimal access approach such as this typically is less pain after surgery, a faster recovery, and a better overall outcome. If you or a loved one suffers from back pain and you're wondering if surgery might be the right choice, let's take a moment to consider your options. They may include a minor condition that will heal on its own, a moderate condition that requires just physical therapy, a more serious condition that can be helped with an MR-guided injection, or possibly surgery may be the right choice. However, the only way a surgery is going to succeed is if the diagnosis is absolutely correct, the technology chosen is entirely appropriate, and the surgeon is an expert technical craftsman. To learn more, please refer to Do You Really Need Back Surgery?, published by Oxford University Press,